What's up, you guys? I'm Kiara Selena, and in today's video I'm going to go over the main nursing school test questions. Let's get into it. Hey you guys, welcome to my channel Nursing with Key, where I make a whole bunch of nursing videos sharing tips and tricks that I've learned along my journey to help you guys have the smoothest nursing journey. Now, before I start this video, I just want to say that I'm a PN student, so I'm a practical nursing student. I'm not a registered nursing student. However, based on what I've heard from other RN students that I know, as well as my teachers who are also RNs, the test questions are very similar. So if you are an RN student, this should also apply to you. First thing you need to understand is your disorders. Understand your disorders and know what they are. Now, I'm not saying to just know what the meaning is. For example, let's just pick a random disorder. Let's say GERD. Okay, you know that GERD means gastroesophageal reflux disease, but that's not knowing what your disorder is. When I say to know your disorder, know what it does to your body. So when you have GERD, for example, you know that your lower esophageal sphincter doesn't close properly, causing stomach content, to go back up into your esophagus. That is understanding your disorder. So know not only what your disorder means, so not only what the abbreviation means, but know what it does to your body. Understand your disorder. So the next thing you need to understand are your causes/risk factors, as well as complications sometimes. Not always, but complications sometimes. So for example, for GERD, you know that one of the risk factors would be pregnancy. A lot of pregnant women get acid reflux, like a hiatus hernia, things like that. And you know, a complication for GERD would be esophagitis. So your esophagus would inflame due to too much acidity in your esophagus from the HCl in your stomach and, you know, from food. So understand your causes/risk factors and your complications. The next thing you need to understand are your signs and symptoms, and this is crucial. This will make you or break you. For us personally, in our exams, the signs and symptoms are worth 25 marks and the passing grade was 80%. So if you failed one sign and symptom question, that took away 25 marks, bringing you down to 75%. So that was an automatic fail. Understand your signs and symptoms. For example, for GERD, you know that a sign and symptom would be, you know, difficulty swallowing or a sensation of a lump in throat or, you know, in chest, sour burp, sour taste in mouth, retrosternal burning, things like that. Understand your signs and symptoms. That is like, that's the creme de la creme. That's what's gonna make you or break you. The last thing that you need to understand, in my personal opinion, is your nursing interventions. Now, you understand what your disorder is. You know what the cause is, you know what the signs and symptoms are, but you now, as a nurse, what are you going to do for that patient based on whatever disorder it is that they have? You need to understand what you're gonna do as a nurse, because that's your role, right? So, for example, for GERD, you would do a lot of patient teaching, so you would advise them to, maybe sleep with their head a little elevated so the gastric contents don't go back up in their esophagus. You would maybe administer medication as ordered, maybe an antacid or something. You would, advise them to eat more bland foods, stay away from acid and spicy foods to, decrease the burning, things like that. So you need to know, as a nurse, what you're going to do for your patient based on their disorder. Now, I know that some of you guys are probably wondering whether or not you guys should focus on treatments and diagnostic tests. For my RN students, I would definitely say that you should, just because you guys go a little bit more in depth than we do when it comes to the whole, medical thing. But for PN students, for me personally, I didn't have to focus on diagnostic tests. Honestly, I don't even think I ever really had a question about diagnostic tests or anything like that since I started, so I wouldn't focus on it too much. However, every school is different, so definitely talk to your teacher about it, because I don't want none of you guys to come blame me for you guys failing. No, I'm just speaking from my experience. I didn't have any questions about diagnostic tests too much. Obviously, even if your teacher tells you that you don't have to know it for your exam, still know it just to know it. It never hurts to just know. So still study it, because you never know what's going to be on your board exam, and I spoke about this in my 10 tips to succeed in nursing school video. You never know what's going to be on your board, so even if you don't need to know it for school, still know it for your board. Anyways, guys, that's it for this video. I really hope you enjoy it. Don't forget to like, comment, and subscribe. I hope to see you in my next video, and have yourself a wonderful day. Bye.